Take it from the top.
Okay. Welcome everybody. Good afternoon. Welcome to the monthly meeting, speaker meeting of East Bay Gray Panthers. I'm Betsy Morris, our co-convener, and I'm hoping that my partner in crime, Carol Crooks, will be able to join us today. I see familiar faces, regular members of Gray Panthers, Michael Haggerty, Patrick. We don't see your face, but I see your name. And we also have a number of, I think, newcomers from today. Diane, you don't often join us. We have Sheryl White, perhaps, and Willie Phillips. Welcome, welcome, Willie, and a number of other regulars and visitors and supporters. Okay, that said,
If you stop
yes,
sharing the agenda, people can see each other better, perhaps.
Oh, okay. Okay. Well, let me just introduce the agenda briefly. As is typical, we start with a few welcomes and greetings. And I'll make a short report until Carol shows up. I'll just remind people that our members, that the board has approved a set of meeting guidelines for, how to treat each other well and hear each other. So Carol, we're sharing that with members when possible, and would love to get approval for those guidelines at our annual member meeting, which will be coming up in October. So I do want to say we will also talk very briefly about recent activities that various members and board members have been taking in the name of our chapter. Then we'll have our guest speakers, which is quite a treat today because it's a very innovative program, and we have Sheryl Morasco and Laura Bell Adaza here from the Center for Elder Independence. Then we'll give a good hour if as interest pursues. And then we have member and action updates. There have been a few requests on that front. And then we offer a little bit of time for guest endorsements or community requests and invitations, upcoming events, the next GP meeting, and then we'll formally adjourn at 3:30, but there's social time until 4 if people want to stay on. Okay, let me stop sharing. Anyway, welcome everybody, and again, we're filling up the house. So I have to pull up my agenda so I can remember. Is there anyone here who is put your hand up or speak up? But for the time being, Robert and I attended yesterday's county supervisors meeting, and Arlene Hip was there. Other folks attended online, and this was to speak up for the various homelessness and affordable housing coalitions that we are part of. So I got 1 minute to say the Gray Panther name. The board did approve a letter from the Berkeley Alliance for Right-of-Ways, or Berkeley Accessible Right-of-Ways, and we have Nancy Rader who will be here to say a few words about that activity. I want to say that a number of us have been active with a kind of working group, More Shelter Berkeley working group, working for sites for vehicle parking and a tiny home village. We're meeting weekly, and we made a presentation. I think Maria spoke, and we made a presentation to the mayor of Berkeley's aide, Julie Sinai. What else? Oh, and the National Gray Panther Council Housing Committee is working now with 2 research assistants to edit up our 2 years of study on housing, the housing crisis, and what our Gray Panther position, will be on this incredibly complex and contradictory set of housing policies that we have. So if you want more updates on that, I'll be getting back to you. I am active on that. Robert, Maria, do you have any short board announcements about your work? Anyone? Okay. Oh, and I've been in touch with the League of Women Voters and gotten interest from our member, Pam White, who bridges the two groups, and the chair of the league, Candea Gandhi. And we're talking about maybe some joint work on issues of homeowner scams, frauds, how senior homeowners have lost their homes. It also affects senior renters. So we're working on maybe a joint, or we're in conversation for next month's topic. So that said, are there any other board updates? Or urgent?
I'll just express appreciation for those who have renewed their membership.
Oh, yeah.
And anybody can do that anytime, just on the website, the join area. And I want to make sure that people know if they miss a meeting or can't stick around for the whole time. We've been pretty good in the last year, some of putting up the recordings, and you'll find those on the menu under events. And we're looking at adding a separate page to find them. But they're there, and we're looking forward to. Please mark your calendars for, I believe it's September 15th this year, the Solano Stroll. We've been mostly, as you know, doing virtual events like this with occasional hybrid, but that's a great chance to come together in person. We've got our booth location now right at the top of the stroll, just below the Alameda, also known as MLK in Berkeley. And so we're pretty close to Zachary's Pizza, and good company. Looking to talk to other people, other groups with booths there about co-promotion and getting the word out, as well as hosting talks in our booth from affinity groups on different topics. So we're looking forward to plugging in with that. So it's Solano Stroll, and it's up on our events calendar. And we also do on our events calendar on the website list some other events as well, that we try to find things that are aligned. So please let us know. Contact us on the website. Plugging message. Thanks.
I'm going to post the agenda in the chat for those who can see, and maybe we'll post it again and update later. Thank you all. If you can change your phone number to your name, that's always very helpful.
They can't if they're calling on the phone, which they are.
Okay.
So.
Well, I feel like we can get ready to begin. I see no hands up. Usually there's people chiming in, but why don't I begin by acknowledging and thanking Ms. Sheryl Morasco, who is the Director of Outreach and Enrollment for the Program of All-Inclusive Care for the Elderly. And I want to thank Laura Bell Adazzo, one of her staff people, who really brought us together. She spoke with us at Laura Bell approached our booth at the Juneteenth Festival and did the follow-up legwork. So I always appreciate that. The PACE program is, maybe you'll be speaking to it, Sheryl, but I've been familiar with it. It's my understanding is that concept, which has now been embraced at the federal level, is pioneered in San Francisco with the Unlock Community Center in Chinatown, and has become an inspiration around the world of what it means to be more, not just a health clinic, not just a community senior center, but something that really fills out and builds relationships and sees people as whole beings. So I'm very excited to learn more about it and your work. And with that, I will now turn it over to Sheryl Morasco. Thank you very much.
Fantastic. Well, thank you so much. We really appreciate the opportunity to address the great Panthers today and deliver an overview of Center for Elders Independence, the programs we support, and how we connect and support to community. Let me share my screen here. So we do have a deck that we do want to share. And then let me try to project this. How are we doing? Are we seeing the full screen?
We are now.
Fantastic.
And
Okay. All right, so this is about a 15 to 20-minute overview, and it's our origin story, similar to the Unlock story. And again, the programs that we support, how we support community, and the new centers that we're opening. We want to highlight that a bit, and then obviously, take any questions as they arise, or at the end, if that's what you would like, Betsy. So I'm Sheryl, this is my friend Laura Bell, and we represent Outreach and Enrollment for Center for Elders Independence. And yes, it's a holistic approach in looking at, caring for older adults in our community. So CEI we're a non-for-profit organization. We have been in this community since 1982. We hail from Oakland. We started out at the Highland General Hospital as the first adult day center program in Alameda County. That's where we hail. And we are three things. We are the Home and Community-Based Alternative Waiver Program, HCBA. We'll talk about that very briefly. The CEI Foundation, which is the philanthropic arm of our business, and the Program of All-Inclusive Care for the Elderly, PACE, this very unique model of care that Betsy teed up very nicely for us. A little bit about HCBA. So this is, again, another program that CEI supports, and everything that CEI supports is with this notion of creating and keeping independence in community. This is another one of those programs. It is not a direct care program. It is meant to maximize case management support for folks in community who are living with, there's a lot going on. So complex needs, high acuity cases of all ages. We have infants up to over 100 years old. And this is really, the intention of this is to get people out of skilled nursing, back living in community, and put a ton of services around them, and we oversee it. This program, we're the agency of record for Contra Costa County and Alameda County, so full counties. We have about 700 people on our census that's supported through the HCBA waiver program now. CEI Foundation, again, the philanthropic arm of our business. It's through the power of philanthropy that we fuel the CEI engine. And how we do that is through a number of things. So through grants, through appeals, through special events and drives. Particularly in the outreach and enrollment environment, how this helps us is that when we identify an elder in our community that really has a barrier to care, and that may look like, we're not able to get into the home because there's an infestation or hoarding or needs deep cleaning. We avail monies like that so that we can provide the care and come into the home. So a very integral relationship between CEI Foundation and the CEI programs. Program of All-Inclusive Care for the Elderly, so PACE. So Betsy is right. This started with Unlock in the 1970s. A geriatric dentist and a social worker came together and said, how are we going to support the needs of our aging Asian community? And they were the pioneer for this model of care. 50 years later, there's a lot of us. And what we do is it's a very comprehensive healthcare model. We are the insurer and we are the provider. So it's a very integrated support model. It's meant, again, to keep folks living safely in community. And we'll talk about all the supports involved in that. A little bit about CEI, so our origin story. We became the 11th PACE program in the United States in 1992. We have served over 7,000 seniors in our time. We've grown to 6 full PACE centers, and we'll outline where they are. We have about 430 people on staff, and our census, so the folks that we care for, the older adults, is actually just a little bit over 1,400 right now. And we have 3 new PACE centers that we're introducing into the community in areas of really unmet needs. Like we needed to be there. So we'll talk about that a little bit too. This is where we're located. This is our service area. So all of Contra Costa County, most of Alameda County, with the exception of, you see, you can't see my arrow, I apologize, but down in that Fremont area, there's the Tri-City area, Fremont, Newark, and Union City. That's supported by Unlock. But we have the rest of Alameda County and Contra Costa County, and we're the only PACE provider thus far. So we're located, we have a brand new flagship center that we just opened that Laura Bell supports, and that is in the Medi-Cal neighborhood of Oakland here. We just opened in May, and we have a grand opening on August 8th. So we're opening 3 new centers in the next 3 weeks. We're also located at the Eastmont Mall in East Oakland. We've been there for quite some time. We are in San Leandro, and we have a brand new facility in Livermore, South Alameda County. That also, we have our grand opening this Friday there. In Contra Costa County, we are located in Concord, and we have a brand new center that just opened in El Sobrante. So this has been our service area for quite some time, but we are very intentionally, deliberately placing our PACE centers, which is a combination medical clinic, social day center, again, where there's very underserved populations that need this access to care. These are the 3 centers. So we just talked about Tri-Valley, that is in Livermore, and that opened in May, but our grand opening is actually this Friday. That is serving Dublin, Pleasanton, Livermore. The PACE West County opening, grand opening next Friday, serves, well, it's in El Sobrante, and it serves the Pinole, Hercules, Richmond, San Pablo, El Sobrante area. And then PACE Temescal, so the Temescal, Oakland area, that's serving Oakland and Berkeley. Worth mentioning that, you know, we did just leave the Berkeley Center. We were in Berkeley for years, but we combined 2 locations into this brand new center. And it's on 39th and Broadway across from Kaiser. So a little bit more about PACE organizations. There's a lot of us nationally, about 180, right? There's different organizations that have centers, these clinics and day center environments in 33 states and the District of Columbia. There's over 82,000 participants in the country now, and a quarter of them are here in California. There's 35, unique organizations similar to Center for Elders Independence. Some are for-profit, some are non-for-profit, that provide this level of care. What's unique about PACE, and you heard me say this, and you hear me say over and over again, the center. It's a high-touch, full medical clinic. It combines a senior rehab gym, and it's an entire team of geriatric-focused specialists who provide care in that environment. And we'll talk a little bit more about what that looks like. So this was made, we know that socialization is the best prevention. So this model of care is, really, really, really important. What's unique about the actual program of PACE is that it's capitated, meaning that for one payment we receive a month, either from Medicare or Medi-Cal, we deliver all services, and we are full risk, meaning that through every stage of the aging process and level of care needs, we travel with that participant. Up to and including if, we do age out of living independently at home, and we do need placement. That is something that we support as well. You hear me use the word participant. We do not call our members of our health plan members or patients. They are participants. And it's really meaningful because they participate in their own healthcare, right? We develop a healthcare plan that is all about them and their unique needs. And we are very steeped in our charter. Again, we're a non-for-profit mission-based organization here, and we are passionately dedicated to providing access to care in everything that we do. So that's how we honor the folks that we serve. So now we'll talk about PACE a little bit. So the PACE program is all about the right participants.
Excuse me,
Yeah.
just real quick, Cheryl, what I cannot actually read the elements of that participation slide. Could you just maybe highlight a few of those pieces on that circular logo you were showing previously? Or are you about to go over that?
So this, you know what, I'm not, but I can later. It's basically the charter for CEI and how we organize in our community. And I do hit on the different elements as we go through.
Thank you.
We go through the presentation. No, great question. Thank you.
Sorry to interrupt.
That's okay. So PACE, again, about right participant, right time, right care plan. So what does a PACE participant look like in community? If we're socializing well, if we're managing our health, if we're perhaps working part-time, driving, we're not frequent flyers in the emergency department, we do not have frequent, hospitalizations, we don't need medication prompting, and we're taking care of our activities of daily living. Too soon for PACE. Conversely, if all that's going awry, that's an older adult in our community that, that we all know, we all know. And this is a plan, built for them. So very comprehensive plan. Difficulty with transportation, connecting the dots. We enroll 25-30%, from Kaiser just because they can't orchestrate the location to location. We're a one-stop shop for all clinical and social welfare needs. This is a PACE model of care in one simple infographic. So the concept of an interdisciplinary team, IDT, that's used throughout the healthcare spectrum, right? But in our instance, we're all located in one building. So there's an 11-member minimum of this IDT team. And imagine the older adult in the middle of that little graphic there. These are all the folks that support this individual, 11-member minimum that shows up to IDT twice a week that talks about care planning for our participants. So we have a geriatric trained physician who is an anchor physician at each center, as well as a full complement of team of nurse practitioners, physician assistants, nursing staff, LVNs, RNs, nutritionists, masters of social work. So social work programming is a big deal. Home care, transportation. This is a very heady endeavor, this PACE model of care. And everyone has a seat at the table in talking about care planning and how that individual is doing, even the driver. And we like to point that out because the driver, so we provide transportation to and from our centers for appointments and socialization, as well as to the community providers that we contract with. We have a very deep network of providers that we contract with. 27 different ologists. So think about that, your podiatrist, your oncologist, your cardiologist, your pulmonologist. We have a deep relationship with community. And that driver, really sees these folks as they present in morning from their home and how they're doing. They're often the first line to say something's amiss. So that's what it is. It's really wraparound services representing each one of these functional disciplines in one location that supports this older adult. And we say all-inclusive care, we mean all-inclusive. So we provide this care where and when you need it. So in our setting, in our center setting, in the home, and in community. So primary medical care is delivered in the center. The specialist medical care is coordinated in community through our network of providers, case management oversight, all emergency room, hospitalization, skilled nursing care, rehab, dental, vision, audiology, podiatry. We contract with folks that have mobile units that come to each one of our centers that deliver this care to our participants. Behavioral health, a big component of what we do. You know, prior to pandemic, it was not. It certainly is now. About 75% of our participant base has a behavioral health diagnosis. A small subset of that, about 25%, struggle with substance abuse, and we have programming for that. In-home support. So we're not only in the healthcare business, but we're in the home care business too. So home care and home health, as well as home delivered medications. Our pharmacy delivers directly to the door. Durable medical equipment, nutritional counseling, meals. Each one of our participants meets with a nutritionist, and food is medicine. You know, we work on that. And then in community, again, the social day center, it's the root of prevention. Think about a senior center on steroids, right? That has lots of activities, lots of connection, and with our other centers as well. Transportation, so that driver, all of our drivers that are, you know, in communication and representing on that IDT team, they move, well, it's about 900 trips a day right now in and out of our centers and to outside community appointments. So it's again a very heady endeavor there as well. And we provide interpreters and medical escorts for those outside appointments. Senior rehab gym, so we work on physical and occupational therapy. And it's not a drop-in gym. It's a meaningful gym for our participants who are there during the day, working on a variety of things, you know, anything from they just left skilled nursing and we're working on, you know, rehabilitation to weight maintenance to, you know, a maintenance plan, gait, balance. So all of this, even up into end of life care, so hospice and palliative care. We do very well delivering comfort care in the PACE environment, but we do contract with a few local hospice providers in community that provide that level of care to our patients should they need it. This is a little bit about the demographics of our participants. So again, a little over 1,400 folks on the program right now. It is actually 60% women, 40% men. Our average age here at CEI is 76. And this is the way that our ethnicities break down. This is the whole program. And each one of our centers has a different demographic, and that could change day to day. At our centers, we run 3 shifts. We run a morning, we run an afternoon, and we run a whole day for those folks that need supervision. So we do work with folks that are cognitively challenged, have memory care issues, very high touch programming for memory care as well. Primary language of our participants. You know, this is fun. In our centers, our staff speak 28 different languages. We also offer support, you know, interpretive support for our folks via video on demand. So these roving iPads that deliver interpretation up to 120 languages, including American Sign Language. And we recruit and align our staff to represent the community that we support. So very deep primary language support here. Sorry. Spiritual care. So I didn't talk about that earlier, but this is some newer data for us. And Laura Bell and I enjoy this when we're out talking with community, because these spiritual care leaders in our community understand the gaps in missions, right? Mission to mission, nonprofit to nonprofit. We sit and we talk about support programs and where the gaps are, and that often includes a senior their healthcare and their social welfare. And they are, they're leaders in the community that that these elders listen to. So in getting to the spiritual care needs, we're able to identify folks that can really utilize our services. And we offer deep spiritual care, support for our folks as well. So 2/3 of our participants are connected to their faith. We have chaplains on board. We host support groups for grief, bereavement, dementia support. We honor our participants, our past participants, with celebrations of life. So this is really interesting, information for us that we thought that we would share. The epidemiology of a PACE participant unique to CEI. So these are the major, chronic conditions of our program. Vascular disease, the behavioral health diagnoses we've talked about, major depressive disorder, bipolar, schizophrenic, schizoaffective, diabetes, congestive heart failure, COPD, dementia. So again, deep dementia support program in here. 45% of our participant base do struggle with cognitive decline, with or without a diagnosis of Alzheimer's or Lewy bodies or frontotemporal lobe. And we've really put programming in place, and our newer centers that we have opened have memory care suites so that we can de-escalate and we can treat these individuals as needed throughout the day. Also wander guards and a lot of technology built into our new sites. What does it take to be a PACE participant? It's really simple. It's four areas. They've got to be 55 years or older. They need to live in our service area, so Alameda County, Contra Costa County. At the time of enrollment, they need to live safely in the community. They need to be safely housed. And that's important for a number of reasons. We've got to, go to a location to provide transportation, to deliver medications, and to deliver care. So we need safe continuity, in the community. And then they must be certified by the state of California to have a nursing home level of care need. What that means is we're managing multiple chronic conditions, we're taking multiple medications, and without our coordination and wraparound services, these older adults would be at risk for skilled nursing placement. A little bit about the outcomes of PACE. So with that I just said, 98% of our nursing home eligible participants reside at home. That's huge, and that's above the standard for a PACE organization within the state or nationally. Our inpatient admission rates are lower than any other program nationally or in the state, 28% lower. And we do a good job of supporting these folks within the community. 93% of the families that we work with would recommend CEI PACE to someone in a similar situation. And again, food is medicine, right? We serve, it's actually over 10,000 meals a month now in a congregate setting, in our centers, as well as meals delivered into the home. So we have our own meal program. We also work with, with Meals on Wheels. Transportation, we hit on that a bit, but again, a very heady endeavor, about 15,000 trips a month, in Contra Costa, Alameda County. We cover about a 1,500 square foot region. And as I said, there's 800-900 trips a day that these folks are, providing for our participants. You probably see I hope you see these vans out there. We have a fleet of about 40 of them. They're purple and they're loud, and on the back of them it reads, "Your life just got better." So I get behind one of them and I get pretty excited. So how is this paid for? Medicare and Medi-Cal. So if we are a dual, right, we're covered by Medicare and Medi-Cal, or we are Medi-Cal only, it's generally zero cost. if we are Medi-Cal only and we have an income above the Medi-Cal threshold, for the state of California, that's 1801 a month. If we're over that 1801 a month, we may have a share of cost that's payable, a share of cost premium that's payable to CEI. But I will tell you that we have an awesome leadership and board here, and we deeply believe that access to care and healthcare equity are paramount. We will absorb that share of cost 9 out of 10 times. So we have very little of our 1,400 paying anything for this program. Older adults can pay out of pocket, so we do. We have 2 that private pay for this program. And what that looks like is the fully capitated rate for Medicare and Medi-Cal in Alameda County. That's about $7,700 a month. That sounds crazy, but when you think about the cost for memory care placement of $8,000 to $14,000, these 2 families want to stay together. They don't want placement, so they're utilizing our services, our respite care 5 days a week. And because they have good support at home in the weekends and in the evenings, this is working for them. So no deductibles, no maximum, no co-pays, no referrals. This is, a fully enclosed system here. I think I just went over this. We're paid by Medicare and Medi-Cal. So capitated program. For the payments that we receive, we deliver all services. Hospitalizations, medications, everything we just went through. So wrapping this up a little bit here, but CEI in this community, we have been providing this model of care for 43 years. We are rooted in the belief that culture and community are the foundation of prevention. Everyone's been trying to get at these social determinants of health, and we have been doing this well and knocking it out of the park for over 40 years. So we'd like to invite you to learn more about PACE in general, to chat with Laura Bell and myself, to tour one of our PACE centers. The best way to really see this model of care is to see it in action. So we invite you to come in, or to have one of us, speak with an older adult in your community that you're worried about. That's where we fit. We do a lot to support our communities. We're always partnering with community-based organizations. And we're a solid employer here. We're always hiring. Again, we've got about 430 people on staff. We are a growing organization, and growing in volunteer capacity as well as our staff. That little QR code up there, and we'll send out this presentation to everyone. Links to our jobs and how you can help support. This is just highlighting again the grand openings. And that is it. So I'm going to stop sharing my screen and see if anybody has any questions.
Maria.
Hi, Marie.
Hi.
Oh, Marie, I'm sorry.
I've known people who were in the program at some point that was doing good for them, but I was given to understand that you have to be able to qualify for Medi-Cal. And are you saying if you don't qualify for Medi-Cal, you just have to pay cash $7,700 a month? Is that what you're saying?
So we are supported through Medicare and Medi-Cal, and very individual, right? When we meet with a prospective participant, and I'm sorry, I want to address that, I didn't. What the process looks like is that we get an inquiry, we get a referral to a senior or a family in need, and we go out and we meet with that individual, and we then invite that person into our center. And that's the best way for us and them to assess suitability for the program. We also sit down at that time to do a full intake. So medical, psychosocial, financial. If we're Medicare, Medi-Cal, and we do have a share of cost, again, we provide help. If we are not Medi-Cal and we need help connecting to those benefits, we provide that support. We have a whole team of benefit support case managers here. So the answer to that question is we can private pay, but for the most part, we're covered by Medicare, Medi-Cal, and will provide help in applying for it. It is an income-driven plan. There's no doubt about that. It is for the most underserved, vulnerable, frail adults in our community. Did that answer your question? I don't know if I lost Marie.
If
Well, thanks,
partially,
Marie.
but a lot of other people that don't qualify for Medi-Cal need it.
And we agree, there is legislation to open the parameters on this. It's been out there for quite some time, but there's a lot of advocacy to make this type of, wraparound services available to other folks as well.
Okay, so
Thanks, Marie. There's a couple of other hands up, so maybe
Okay.
come back around for follow-up questions. I just want to acknowledge, which our member Norma has done in the chat, that, under capitalism, our medical system is not doing as good a job of taking care of people as possible. So your response as a nonprofit, one question might be, are you competing with other for-profit medical systems? Are you an alternative? And I also see that she, not to speak for her, but essentially, how are you all engaged in the battle for universal health care, which is not an act, there's still active campaigns, and Gray Panthers from its beginning has been a supporter of that. Could you speak to sort of your political alliances or challenges?
I think we're all in the same boat of really trying to understand, the recent legislation of that big, bold, beautiful something, right? And when that will take place. And it looks like it's out to 2026, 2027. We're doing a lot of work on the advocacy standpoint in Washington and locally through NPA, National PACE Program, National PACE Association, as well as CalPACE in supporting all the programs in California. We don't know yet, but I will tell you that this model of care is sustained for 55 years through, a number of different partisan, nonpartisan efforts. And we're prepared we're committed to supporting this community. Again, we are part of a foundation, we fundraise, and of course, that's not going to handle if, what happens to Medicaid overall. But I think we're all in the same space here, is that it's a wait and see approach. There is a lot of advocacy happening, but I really couldn't comment beyond that, quite frankly.
I see. Thank you, Sheryl. Christopher, you have a question, and then Maria Sol has her hand up as well.
Okay, bye, Christopher. You may be on mute.
Hello, can you hear me now?
We can, yes.
Okay, my computer is wrestling with me. I think you may have answered my question earlier. I had been in touch with a local CEI center, which is only like a block and a half from me, and that seemed really convenient. But do I understand that you closed that to move it to Medi-Cal?
We did, yeah. So off of Alcatraz, that center did close in May.
Oh,
and
okay.
we relocated staff and all participants to our Medi-Cal location.
Oh, okay.
Okay.
Thank you.
Yeah. Was there a follow-up question?
No, I was just trying to
Were you trying to
that
get in
because
touch?
I had been in touch with them. We were trying to set up to have me come by and do that initial look-see and all that. we didn't get around to it. And I
I
went,
do remember you.
oh, you do?
I do.
Oh, okay. Yeah,
And I would love to reconnect.
it wasn't out of mind though, you know, it just kind of got delayed. And I just heard you talking about your centers and I didn't see that one listed.
Yeah.
Mm.
We would be thrilled to tour you at the new location and see.
Well, maybe we'll
what
make
you
it
think.
rain.
Okay. Maria?
Oh, yes, Miss Cheryl. I couldn't be more impressed. And how many of you are you doing all of this from the inside out and the outside in? Holistic is the understatement. So thank you very much. And when you talk about healthcare and social welfare, this is not only affecting the people that you directly address, but the community surrounding it as a model. And I understand that some of us would like to do everything, but often when I have experienced focusing on everything, we end up doing nothing. So I want to appreciate the fact that you are first addressing the most economically and socially and personally vulnerable and in need people, because again, they often are the last to be served. And it's not like they should be first, but God is a great place to start. And the fact that you are so successful, I pray that it will be a model that is contagious for everyone because everyone deserves to be cared for. So, again, thank you so very, very much.
Thank you, Maria. Thank you so much. I appreciate you saying that. You know, we've been in business for 43 years. We've been serving this community, but we really only serve about 10% of the eligible lives for this program in both counties. There's so much more awareness that there are options. So the first question I think I got was, are we in competition with the larger plans? No, we are not. We are not in competition with Kaiser. We are not in competition with Sutter. We are not. We are a unique model of care that offers, you know, a real viable solution to the most vulnerable. And we have those conversations with healthcare providers every day. We don't want to take your members. We want to help you, you know, address the folks that leave your office that you're worried about, who don't take their medications, who don't follow through, who really need help connecting the dots. Not competition. We want to fill a gap.
And Miss Cheryl, again, that on a functional, personal, and systemic level is so key, because the fact that some of us that are trying to do the same thing are competing with one another is just horrifying to me. If
Yeah.
each of us do what we can, it'll all get done. And we don't need to do it in conflict. But then I also wanted to address, I deal with very severely traumatized people. And
Okay.
I have witnessed that once they get identified as being very challenging, they often get blackballed and dismissed. And when I heard you describing all of the people that tend all, you know, each and every person, I'm sure from what I feel from you that you don't let that happen. You don't let someone get written off because they're just too difficult, right?
Yeah. No.
Yeah. Well, again, I just want to hug you and thank you and
Aw,
and
thank you
send
so
you
much.
vitamins. May you keep breathing. All right, and keep breathing. All right, thank you.
Thank you, Maria.
So I see,
Willie?
thanks.
Good afternoon,
Hey, Willie.
Cheryl. I'm a little dismissed because your center has moved from Sacramento Street and Alcatraz, if I recall. I'm sure that there was a reason, but that happens to be right around the corner for him where I live, actually.
Yeah.
So
I apologize for that, Willie. You know, we outgrew that space. We were not able to serve all the participants that we needed to serve. It was a difficult environment for us. We just outgrew the space. We needed more. these new centers that we've built, like that one at Temescal, is the capacity to serve 700 older adults. So it unfortunately needed to happen. Yeah.
Well,
I
it
understand.
happens. You grow out of your space, and needless to say, you have a very challenging particular challenge in terms of being able to outreach to people. And I happen to be African American, and I notice that one of the smaller slices of that pie happen to be African Americans. And I wanted to ask um, why. And I also want to actually, I had the privilege to talk to one of the founders of PAY, actually, Dr. Spurs, I think his name, but and I guess I have to promote his book as well. He has a book that's out, actually, which is actually he's been doing talks around that, Fly Away. But I wanted to kind of like be able to. Is there a difficult time basically reaching out to African Americans? That's my question.
I'm sorry, I'm gonna go back. I want to go back to my graphic slide. And so 17% African American, 15% Caucasian, 17% Latino. Asian is high, 46%.
Yes, and I saw that.
Right, but I'm finding my words, Willie. I don't know the answer to that question. Can I turn that around and ask you why you think that?
Well, that's a good question. I think that African Americans are scared of being institutionalized or even being socialized in some form or another, because there is the suspicion of any organization or institution or government agency being over. I mean, we have a natural suspicion in terms of the very fact that we don't trust various particular organizational structures as it stand now.
Okay.
We also, I think, have a very strong aversion to some of the biases that might be betrayed in those particular institutions, and they are, in many cases, are not intentional, but they are part of essential structural racism, which also kind of basically is part of I guess you would call the distrust. And I'm not saying that because I've seen it from the inside. I've been involved in organizations for a long time, and Betsy could probably testify to that.
Oh, yeah.
But I also realize that those things are not going to go away without actually having really true dialogue on that.
Willie,
They're uncomfortable.
you don't mean the biases are betrayed. You mean they're displayed.
They are strongly displayed.
Yeah.
I'm on boards. I'm on RCD's board, and we're on. It's like, it reminds me of Palestine. People are throwing flames, and this is at the very high level. You don't have to tell me what's going down at the bottom, because you can see that through the displacement of African Americans in particular. You can see it in terms of the statistics of African Americans that are homeless, proportional wise. So I don't think that it's going to go away, but I think that it has to start from the bottom versus the top, in terms of people basically bringing those things to the intention of these basically institutions and organizations. They do very well. They do a lot of good things in terms of providing homes for people, in terms of resource for community development. But when you're looking at the very fact is that you're still basically entrapped in what is known as institutional, which is translated through essentially through structural particular particular implications or implementations more so, you are going to always have that resistance. And, but I also see that you're not reaching out to a lot of particular, my mentor call it pink people. I'll, say European descendants. And I see that as being another issue. Why is that?
I think from I so much here, and I really appreciate the conversation. I think for us, because we need to be invited, we have very strict guidelines about how we market. We can't go door to door. We have to be invited, to speak with a senior. It's a serious process, and a lot of folks are in these multi-generational living, and it's very difficult to market. It's something that we're trying to get at. Again, traditionally for CEI, our outreach has been to seniors who are actually well supported, that are living in senior housing or connected to their community-based organizations. They are the least likely to need these services. It's the ones that we have to turn over the rocks to figure out where they are. So we have a team of 30 people here, and there's 14 of us canvassing, our communities, meeting with people every day in homes and shopping centers and pizza places, in skilled nursing facilities and doctors' offices. We are everywhere at older adult is, trying to create that awareness. So Willie, I'm promising you, we're working on that. We really are. We've really upped the game with trying to let everybody know there's this option.
I'm going to jump in. There are some hands up, but I want to really appreciate Willie for bringing that up, of course. And I put the name of the book in chat, but if you have actual more detailed information, Willie, please, and you're able to use the chat, please put that in. I want
I'd like to invite him to our meeting, or to the Great Panthers meeting, because he's a very
that would be very cool if he's local.
He was actually the director of health and human services at Berkeley for a moment. So
my goodness. Okay. So one of the things, I was struck by the demographics because they're not as typical to what I see, but how is your staff at sort of being able to welcome? I mean, you can't force people to be with certain other gerontologists or social workers, but two things. One, how do you recognize and engage culturally with people of different backgrounds, including, some of the terrible biases, with our Black seniors? How do you engage? And second, if you want some recommendations and invitations, just want to let you know, I think some of us here would be happy to support that. But in particular, do you have, for example, relationships with groups like Healthy Black Families here in Berkeley? And I also want to back up. I'm sorry, please answer that. But I did want to back up and let people who didn't have the context know that Grey Panthers was 50 years ago or 40 years ago, very, very involved and proud of the creation of the Over 60 Clinic, which many of our members go to. And I think, and you all had a little office in that Over 60 Clinic.
Yeah, we shared the space.
Yeah. And then the building has housing on top created by RCD, and used to be called Maggie Kuhn Apartments, which is our founder, the Grey Panthers founder, who was a white woman, and then got renamed to Mabel Howard Apartments. Just a little background, who was truly a hero, Shero, of South Berkeley, of the African American community, and for everybody who appreciates BART being undergrounded in Berkeley. So, but let me just, that context, geography matters. So So can you speak to how do you navigate, people's personal trust fields by seeing helpers who look like them, and at the same time, truly serve all, like training for your staff or whatever. Can you speak to who your staff is and how you partner, or if you partner with other, more specific racial or ethnic groups? Thanks.
Sure. So from my organization, from an outreach perspective and engaging with community, we're doing a much better job of that, and engaging with, local community-based organizations that are culturally specific, like the Good Life. Speaking with organizations like you, this is the opportunity to create that awareness and those partnerships. From a staffing perspective, like I said, we align our staff. We are very diverse staff. I need to put a slide together of that, because that's meaningful. But the languages we speak, how we align our staff to our centers are very unique. Each center, every day, every shift is very, again, culturally specific. Like we attract and we like to hang with people who are like us, and that happens at our centers. We're also very steeped in, it used to be called DEI, but it's now called the CEI Alliance. It's still a big, meaningful part of our organization to address, equity and inclusion. So it's very much a theme of our charter and how we represent in community. My staff is very diverse. You wouldn't know that by me, but but we do. The communities that we support, we align appropriately. So I hope that answered that.
We got to work on it, I think.
You do. Yeah. We all do. We all have a lot of work to do. Yeah.
I just want to note yeah, I'm sorry. Did you want to, you're next, Norma, if you have a question you want to ask.
Okay, I'll try to ask this sounding like a question.
We are.
Yeah, I don't have questions. I have lots of activism.
Okay.
And hello.
Hi.
And I put in here, in case you didn't get a chance to notice it, my great regard for the work you do. So,
well, thank you.
I wanted to comment that Willie's comment that we're dealing with institutional failures or ruinations of our relations with each other, with the systems that we try to use in order to repair the breaks in our society. The institutions are long lasting. They've been here for a long time, and they're going to continue as long as we have to bow to the profit system. White people think we're not enslaved. Well, if you think that your relationship, maybe of sitting in a car for hours to get to and from work, or doing work that doesn't feel good to do, and that you have to be there for 8 hours a day, plus, all of those behaviors that are required of all of us, and so many white people are subject to the enslavement that is not us getting lashes on our backs, but it is the enslavement to keep our owners wealthy and strong. And Willie is right, the institution, or maybe I'll say, do you agree with Willie that the institution, I don't have to ask it as a question. Willie's
well,
right.
Thank you, Norma. Thank you. And I got a request, Willie, for the name or spelling of the author of the book, because several people have tried to find it, to put it in chat. Is Willie still here? Okay, well, okay, he may have had to
I know he is, but he's
Willie is still here.
Okay.
I'm gonna put it in the chat if I can.
Thank you. I see that Marie
Marie.
K. Yeah, thank you.
Hi, Marie.
Hi, I just wanted to know the exact location of the new center in West County.
Hang on, let me just pull up that address real quick. I know it's on San Pablo Dam Road.
Dam Road.
Laura Bell, could you quickly look that up for me, please? Just the actual address on San Pablo Dam Road and put that in the chat.
And that map I thought was great to show all the centers. And I'm hoping Laura Bell or you can give exact information about the openings and how we could go and learn more without
Absolutely.
this week. One of them is Friday.
I will, Betsy, I will send this deck to you afterwards. I'll also send out the invitation for each individual grand opening. There's little QR codes to register to come.
I don't have everybody's email who
Okay.
shows up on these calls. Some
So
people are
what's
in
the-
our usual suspects, our East Bay Gray Panthers database, which we don't use too often, but maybe everyone here is on that. So we
Okay.
try to make it available
Bell.
here.
Do you happen to have the invitation available that has the 3 locations on it and the dates and times? Hang on a second.
I actually have seen it, thanks to Laura Bell, but to try to, I may take me a little bit to dig it up off of a very large email.
Let me try to
inbox.
locate
I got it
it.
There we
sitting
go.
right here, but I gotta get it into there for you, so.
Yes. Thank you. It'd be
Is there
great to do a
another
field
question
trip
while
with
we
some of
work
you
on
all.
that? Sorry, I'm trying to find an electronic version of this as we're chatting here. Are there any other questions while we work on this? Here we go. No, that's not it. Sorry.
Might be something for Gwen.
I think Gwen has money.
She qualifies for Medi-Cal. They got her qualified something.
I'm not able to post an image in here for some reason. Sorry, guys.
Not in, Laura Bell, I know you sent me an invitation, or maybe I just saw it when I was looking at your website.
Yes, I have actually, I can put in the chat the link to RSVP for our Temescal one. And then I can also post the links if you wanted to RSVP for our West County or Livermore one as well. I'll just locate that and then I'll put that in the chat.
Thanks.
Thank you.
Of course.
I want to share some comments, but also one of our younger members, Aiden Hill, works with, I believe, the mobile health team with the Lifelong Medical over 60 clinic. So he goes out and reaches, what do we have? 12,000 people between Oakland and Berkeley who are aging rapidly.
Yep.
On the street. And I realize that's not your wheelhouse, that's not your specialty, but and the housing crisis exists. So I just wanted to flag that I was hoping Aiden could come today. He was actually going to ask his boss if he could show up. Maybe we can get him another time, Maria and others, to share his experiences there. And I do know several people have had some, I see Christopher, bad experiences with Lifelong Medical. I also wanted to flag that someone called Gray Panthers, so I spoke to her from Santa Rosa, who had a bad experience. I think she made with the PACE program there. And we're just saying, how do we hold our absolutely vital service providers, helpers? How do we how can we speak to people's both individual concerns, that needs that aren't getting met, and also how do we foster dialogue? That's kind of a question, so we can have mutual accountability, because the issues, sometimes are totally outside the scope and ability of an agency like uh, PACE program. So maybe you could speak a little bit about who it's not for, like just honestly, who are there some people who should consider other alternatives?
Like me.
Is that Marie who spoke that? Yeah, who is it not for, whether it's by income or condition or just your own
It's
limitations?
not, well, when we talked about when's the right time for PACE and when it isn't, right? So if we're healthy and we're working and we're coordinating our own care, it is not time for PACE. If these are vulnerable, at-risk seniors who, who prescribe to PACE and who join PACE. It runs the gamut though. I mean, because there are not a lot of day center program options. I think there is one in Contra Costa County now outside of us, and we're a health plan, so you've got to fit the bill for all of our eligibility criteria to participate in a day program. That outlines, an area for us that's just really underserved. So we get a lot of inquiries from people of all demographics, all financial parameters, looking for day center, looking for memory care. That's sometimes not relevant. And we have an age requirement. It's 55 and older, but if we're in our 50s or 60s and we're still well supported and we're working, it's not for PACE. It's a model of care, that provides access to those who don't have it.
And at the same time, I think you said like $1,800 a month was kind of the
Yeah, the
max
Medi-Cal.
for free enrollment if it
Yeah.
was otherwise eligible.
Yeah, so the Medi-Cal parameters for California, that income threshold monthly is $1,801. And that just raised a little bit in April. And this is another area where it's unclear what's going to happen going forward, because there's state legislation that's being introduced on the asset level again and working parameters. So that's what we want to,
And
keep in
what if you
view.
have more than 1,800 a month in income, so you're not Medi-Cal
Yeah, if we're well above and we're not going to qualify for Medi-Cal, then we're looking at private paying for this program.
and is that 7,000 a month? Somehow I heard that number.
It's around that, yeah. So
Wow.
the capitated
A
rate,
month?
correct. The capitated rate for
Wow.
this program, what we receive for Medicare and Medi-Cal and for Part D is about $7,700 in Alameda County. It's
Oh, you receive that.
yes.
Oh, so that's not an income. That's not the amount a person has to pay you if they're on Medicare, right?
No, right.
They're all
That's
on
correct.
Medicare.
Yeah, no, the benefit is covered. However, if we're above that income threshold and there's a share of cost
Right.
that can be paid to CEI, we look at that on a case-by-case basis. And we do absorb, and I'm going to throw a number out there, but this is a real number, about up to $1,600 a month for individuals to pay for their health care. We take that on, again, because we believe it's paramount to provide equitable health care to everybody.
Thank you. Thank you. And I'll draw attention. Willie has put the book in the chat,
Nice.
and Laurabelle has put a link to the grand opening of the Temescal Center. There's also an address for the West County Center. And then Maria Soul, you've got the last question.
Yes, and I really want to apologize.
comment.
My phone disconnected me from all of you, so I might have missed something. But when I got back on, I heard two things that I really, really, from the inside of me, have to address. Number one, There isn't anything that I know anywhere that's perfect. And it's like, oh my God. So I do not want to chop an entire tree down because one branch broke or dropped someone. Not that anyone should be dropped. No one should be hurt in any way. And the good that is being done needs to be recognized and empowered. Perfection cannot be the enemy of the good. And that is not only with regard to this program, who it is able to address and who it isn't able to address. People that I deal with on the street age faster because they don't have a home than any other population. And the fact that I was told I can't have surgery if I'm on the street, because how would they take care of me? It's like, okay, there's a lot of gaps, but let's not tip over the stuff that is doing what it can do. That's why there's so many of us doing whatever we are able to do. And lifelong might be imperfect, but I would have been dead 8 years ago if it weren't for them. So again, one, or two or three, it's not perfect, but oh my God, the bazillions of people would be bereft without lifelong. So let's please embrace the good and strive for better, but let's not pick apart things that are doing some good. We need every little bit. Thank you.
Thank you. Thank you.
Thank you for saying that, Maria. We're all perfectly imperfect, aren't we?
Yeah.
Yes.
Can we all either open our mics or send a reaction to just thank Cheryl and Laura Bell if you have to step away as well, but if you're sticking around, that'd be great. I know you're both working, but thank
Yeah.
you, Cheryl.
Thank you.
I can
Thank you.
applaud, but other people are welcome to send whatever reactions and
I put a note in the chat saying that I was really appreciative of their work.
Thank
yes.
you so much. Thank you, everyone. Thank you again for the opportunity. Every time that we get to chat with people in community, I feel like there's new ambassadors out there that now know about PACE. And you're mindful when you connect with a senior who could really benefit by our services. So thank you for the opportunity.
Thank you.
Thank you, Cheryl. I look forward to connecting with you again.
Fantastic. All right. Okay.
And we have links. Everybody who got an invitation or can go to the East Gray Panthers. We have links to PACE and CII. Is there a phone number you want to say out loud for anyone who's, not currently connected?
Laura, but what's the best number? Sorry.
No, this is all good.
Laura, what is your cell phone number?
It's
Oh, my
that is the
goodness.
best number.
personal.
510-414-4401. I'll also put it in the chat as well. You can call or text me, and I'd be happy to answer any other questions you may have after the meeting. Yeah.
Thank you.
All right. Thank you all so much. Thank you.
Let's all give hands
Thank
up.
you.
Thank you both.
Have a lovely day. Bye now.
You too. All right. Wow, thank you everybody for working through, and being here. As we let me say that we usually transition now to more internal chapter member and visitor announcements and reports. But did everyone get what they needed as far as any kind of follow-up with our guest speakers today? Speak up or okay. Her Laura Bell's cell number is in the chat, and she, I think, sent her own. Does anybody want to go to the Temescal opening from 3 to 6 on Friday? On August 8th, 3 to 6.
I would like to, Cheryl.
Hey, Cheryl.
Hey, interested in it. I don't think I'm ready for that program yet, but I would be interested in seeing the facility.
Okay. I hadn't realized, I'd forgotten they were there in the over 60 clinic on Alcatraz. And so this is another opportunity, I guess, to visit. And yeah, let's talk.
Actually, they weren't located in the over 60. They had their own building on Alcatraz.
Oh.
And I
Okay,
was
thank you.
exploring them as an alternative to Lifelong.
Okay. I just thought I used to see their logo on the door at over 60, but that could have been a few years ago. So, but okay, great.
Understanding they were there actually. And they relocated recently actually. So
Yeah.
and it's right around the
and
corner for me. So
yeah, you and Christopher were apparently close by and aware.
Hey, Willie, I guess we're kind of neighbors.
hey.
I'm on King and Harmon.
Oh, we are right around each other's corner here.
We'll have to get together for coffee.
Yeah, I would love to.
Pete's.
I have to go, Betsy, but I just wanted to please share his number with me when I reach out to you.
Oh, Christopher's?
Yes.
Okay. Are you good with that, Christopher?
Yep.
Then
Yep.
we'll make it happen.
Let me make my comment before you leave, Willie. You know that I run for school board every couple years, right? The problem remains the same.
Well, I voted for you.
It's who?
You have one vote. I don't know if you got any others, but
one of the things I came across while doing things was a discussion by old people about what was necessary, and what they needed was to live with meaningful involvement with the community. You don't have a job anymore, but there are places where we belong, doing things that are satisfying, the same way we might be doing, as I say, capitalism gets in the way of it, the structure, but doing things that are meaningful within the community. Children need that. Even if they're in kindergarten, they're saying, well, daddy goes off to the job, and what do I do? I go to school, and they tell you, well, it's meaningful to have a classroom relationship, but the children know that it's not satisfying. It's not socially satisfying. It's not socially rewarding. And so old people need the same thing. And so that can be an objective that we old people tell ourselves about how we should be living. We should still, even though we have to grab 2 naps a day.
Well, I am in agreement. I've always been an advocate for basically connecting elders with youth, because we all can mutually learn from each other. I am not going to be basically socialized on social media, but I think there's a lot of things that we can learn, and it's a two-way street.
So actually, since you have to go, Willie, do you have any announcement or of any upcoming community actions or South Berkeley from Friends of Adeline that you want to share right now? You don't have to, but
I'm sure there's a lot of things, but I don't actually. I'm getting old. I don't remember.
That's right. Well, anyway, good to see you.
Okay.
And
everyone
who's shown up.
It's good. It's good to be here. And
when we get old and forget, I find sometimes I just turn my head. I can't remember. Oh, it was sitting right over here, and I remember.
Yeah.
So it's there. It's there. You're not losing your mind. The behavior is different, but it's you're not sick. There's nothing wrong with you.
You're totally correct, Norma. Okay. And needless to say, you're older than I am, so I have to say that you're wiser as well.
Well, yeah,
Hey.
now I know everything. I told you that.
You guys have a
So-
great evening now.
Take care, Willie.
All right.
Okay, thanks, everybody. I have to be a little bit of the time disciplinarian, crack the whip, because Carol's not here. I wanted to share that we now move towards member and action updates. So back a few months ago, the board and members endorsed joining Berkeleyans for Accessible Right-of-Ways, which is a partnership with our board member Helen. Helen Walsh brought this to us, and Cheryl White was Carol. I'm sorry, not Cheryl. Carol Crooks was our liaison, but because of her surgeries and whatnot, she's had to set that down. And in the last few weeks, we put out a request with the most recent letter of Barrow, asking, making recommendations to the City of Berkeley Transportation Planner. And this is about the integration of people with disabilities, pedestrians, and bicyclists that is happening on our streets. And, I wanted to offer the floor for a few minutes to Nancy Rader, who's joined us from Barrow as an individual member. Maybe you can just remind us who the partners are and what might be the next step for us as Gray Panther partners. Nancy,
Okay, thanks for having me.
could you turn up your volume a little?
Let me see. Let me try to speak louder. Is that
Mostly
better?
this means a little closer to the microphone, or yeah.
Is that
Yeah.
is that better?
No,
Uh-oh.
not really.
Okay.
Up to all of us, we can turn our volume up. So
Okay, I'll do that.
I think I can increase. Is that better?
possibly, but
Yes.
Mostly it's your own volume you're controlling. I think.
Yeah, I just increased it. So is that good?
So just yeah.
Okay, so Barrow kind of evolved out of Measure EE, which was on our last ballot and failed because Measure FF got more votes. But many members of the disability rights community supported Measure EE because of its focus on safe sidewalks and streets. We would have put more money into it. I was a co-organizer of Measure EE, and Measure EE would have put more money into fixing our sidewalks than Measure FF, even though Measure FF will collect a lot more money. But anyway, this kind of grew out of this Barrow effort, where we wanted to continue to engage on behalf of the senior and disability communities to make sure that Measure FF funds are spent well and in consideration of the needs of these communities. And so that involves also getting involved in the bike plan and specific projects. And so our latest letter was on the Telegraph Avenue plan. And let me just say some of the folks that have been participating actively, representing organizations are Mackay Freeman from Center for Independent Living, Helen Walsh representing UCC Disaster Ministries, Mike Cole, East Bay Center of the Blind, Carol on behalf of Gray Panthers, the senior pastors of the First Congregational Church of Berkeley, and Ashby Village. And then we've also had Friends of Adeline signed one of our letters, but I was hoping Willie would stay on so I could update him, but he didn't sign our last, or they didn't sign our last letter, just because I couldn't get a hold of him. Anyway, so our latest letter, which Carol signed on with an asterisk saying, not representing Gray Panthers, but just using her title. So I think what you're considering now is whether I can remove that asterisk so that Gray Panthers
Actually,
is signed on.
You had permission, and I sent emails like a week or more ago. We've gotten a quorum of voting members to support it. We did have a couple questions from
Okay.
2 of our board members, and so that kind of follow-up would be great to follow
Okay,
up.
that's
with
great.
those concerns.
That's
Yeah.
great, because we're gonna issue it again with more signers, because usually we're under some deadline and have to get it out, and then we put it out for more signers and issue it again. So in the next version, I can take off that asterisk, which is great. So yeah, I'll stop there unless you want me to summarize what's in that letter or just go on to questions.
Are there questions about this? I mean, this is not just Telegraph Avenue. It's also something we have not, that about 2 years ago, we had Helen and I, Helen has been working diligently, our board member, and there's some statement of principles about urban design, about sidewalks and roads, and how to make sure transportation is safe, or at least gives everyone a fighting chance for how to cross streets fairly. So I would like us to come back and have a platform as a group that says these are some fundamental principles around fair sharing, rights of ways. So what you're doing, Nancy, is really important because it embodies those discussions, but the issues are still out there, regardless of whether it's Ashby BART, North Oakland BART, killer intersections. I see, it's a bigger issue. So what am I saying? I hope we're not just signing off on a letter, even though that makes it easier for you. I'm hoping we'll have the education so that whenever we feel a need to speak up, we will have a shared, set of bullet points. These are things we agree on, even if it's not specific to a specific location. Anyway,
Yeah.
did that
And I
make
think,
sense? Yeah.
yeah, and we did have a broad letter on Measure FF.
Yeah.
And
And we
Carol
signed on to that.
that,
It's
yeah.
just Berkeley. So I see Maria has a question.
Oh, first of all, Miss Nancy, thank you, Betsy. It's so good to see you, Nancy. What you're doing is just imperative. What blows me away is like when I go to Alta Bates or Sutter Health, the sidewalk splits are like an inch or two, where tripping is the easiest thing to do. So this is a never ending thing. And it's not just the crosswalks or the bicycles or the cars, it's the scooters. It's anyway. So just thank you. I'm just wanting to say thank you, and please reach out to me and let me do more to support you. Thank you.
Thank you, Maria. You are now on my list, having met you a week or two ago, and I will definitely put your name on this updated letter as an individual signer. Christopher?
Yeah, I've been a supporter of EE as opposed to FF because my understanding of what the differences were. And I think that a lot of people don't really understand that behind FF is the entire complete streets deal. We rarely hear it mentioned much, or its origination, or what the difference is. You guys, I think, help clarify that it means a lot more money is going to be spent, and it's going to be according to pre-existing kind of design plans rather than more custom local ones. And I think we need the public to become a little bit more aware of why that is and what it is, so that you can comprehend what the choices might be for us to support.
Yeah, I think it's going to come down to a project by project review, because one of the council members asked, are you going to ask their staff, are you going to come to us with, kind of your vision for Measure FF implementation? And the answer was no, you're just going to get individual projects to review, which is unfortunate because, the council really should set some direction. Like, for example, we've called for holistic planning, where you don't just design things for cyclists, you look at the whole picture and try to best balance everyone's needs.
Well, the complete streets are supplied with sets of design models, and they're given all the way down to scripts on how to present these as if they're locally generated when they're not. What they do is they tend to select from ABC complete street design, and we'll use this model in this location. They're not really designing to that location. That's why it costs so much more, because in every implementation, there's a bunch of stuff going to be included that may or may not be necessary or even desirable. And if we don't understand what those two ways to go are, it's hard for us to make choices. So I think that, you know, we need to help clarify that for everybody, what complete streets is and how it's been essentially jammed down our throat and our pocketbooks.
Yeah, and then maybe what's happening on Telegraph, you know, the Telegraph Avenue plan had 3 different concepts, all of which had a bike lane.
Yeah.
So they varied whether there was a bus lane, they varied whether there was a left turn lane, they varied various things, but the cycle track was a fixed feature, even though there are bicycle boulevards paralleling on both sides.
You might remember it was 10 or 12 years ago, it was put up for vote on whether to turn that section of Telegraph into a mall, so to speak, and it was voted against, definitely. So but they didn't give up. I figured it would come to eventually, they would just make it happen anyway.
So moving on, Maria, did you have some?
Yeah, I have an additional question. I'm
Okay.
confused. On University Avenue, they are talking about bus islands. I have no clue what that is. And secondly, what you say in terms of a holistic design is imperative, because each of these independent, competitive, sexy projects have so many unintended consequences that create more problems than sometimes they solve. So again, this is a point of view in terms of working together rather than competing. But please explain what those University Avenue bus island things are. Thank you.
Well, I know what bus islands are, but I'm not familiar with what's going on University Avenue. But the bus islands, for example, if you've been down the Oakland part of Telegraph, you know, there are bike lanes next to the curb, and then there's an island out in the street where people will disembark from the bus. And those are really problematic, particularly for the visually impaired. And I think it's the American Council for the Blind has called for a moratorium on these islands until they're better understood.
They're in between the bike lane and the traffic lane?
Yeah.
Yeah.
That's ridiculous. All right, bless you. Thank you.
So,
Yeah.
So thank you.
Pedestrians crossing the bike lane.
So I'm going to draw this to a close, but what we really need is liaison, somebody who can either work with Carol or while she's out of commission can attend Barrow meetings and other kinds of engagement with the Transportation Commission here in Berkeley or the transportation for the county somehow. And Nancy, I'm hoping that you might be available for follow-up so someone could call you. But
Sure.
Panthers and guests and friends, we need someone to keep us abreast and speak up for Barrow or other transportation related partnerships, because Dave Blake who used to be our sort of public transit advocate or, you know, liaison with a county group that does that is
Betsy, I'm happy to do this.
sweet.
I enjoyed Carol. We interacted at a meeting. This is preeminently important to me because I do not want to see people trip or get hit. You know, preventing harm is the simplest and best way of,
And
yeah, thank you.
great. And I'm not exactly sure, this isn't my wheelhouse, but you could talk to Helen. Helen usually has her finger on multiple groups. And Nancy,
Or
maybe
me, I have Maria's email, so I can connect you with Maria.
beautiful, beautiful. And Christopher, I'm expecting, you know, that when we can plan, that we could plan for bringing in some public speakers on this topic. I'm not sure when, kind of helps when people are nudging to get on the calendar, but
Nancy texts me, email is hopeless. Please just
Right,
text me. Thank
right,
you.
okay, okay.
thank you all. And thank you, Nancy. Is there a next step you want to alert
Well,
us to?
if you've signed off on the letter, that's great. That's all for now.
Yeah. And I will just say, to respect the members who do ride bicycles, that we'd like to probably get their input as well, since we're all of us
We're
older.
not anti-bike, but we're
No.
pro-balance in the viewpoint.
I ride e-bike.
Beautiful, beautiful. Okay, and
Okay.
thank you.
Thanks for having me.
Really appreciate it. Okay.
Question.
I'm gonna hold off, Norma, just hold off for a
Okay.
moment.
I put it in the chat. I did.
Oh, great. You want to just read the chat so we can see it while I look up the rest of my agenda here.
Has there been any attempt or need to look and see if there's any particular population that needs addressing by our concerns? To be reminded not to knock down people in their cars. There's a lot of people knocking down people in their cars, and maybe there is a group of certain age or attitude or time of day.
It's a combat zone out there, and it's not just the cars, it's the bicycles and the scooters and the e-bikes. People are forgetting that courtesy and concern and mutual care matters. It's not every man for himself over someone's dead body.
Okay, so it's not a matter of a certain population being the people who get.
Well, when we had a speaker from the Traffic Violence Coalition, mostly in Oakland, where they've done analysis of intersections. So that was last year, 2024, really good presentation. They acknowledged that driving higher trucks and vans and SUVs puts the driver in a place where they cannot see people whose heads are below the mirror on the passenger side, right? So there's a problem with those kinds of right-hand turns, apparently. And the other thing is go to my Facebook page. I posted recently an article from Rolling Stone that was research done in Berkeley showing that drivers of BMWs have a propensity, basically more expensive cars have a greater propensity to cut off other drivers and pedestrians.
Too fast?
No, not saying they're actually killing people actively, just that the researchers found those drivers tend to be less sensitive to who else is using the intersection.
So we're talking to everybody.
Well, I don't have a BMW, but we could all be there. Okay, thank you. So should we take a moment of break? Anyone who needs to take a break? Otherwise, we're starting to get in the home stretch here.